Hello, everyone. Immune system. We've been talking during COVID about strengthening our immune system throughout the world. How can we do that with the help of Chinese medicine is the topic of discussion for this session. We are talking with Mr. Gadi Marcus, who is a licensed acupuncturist for the last 20 plus years, as well as a professor in a university in Israel. He is going to be joining us live from Israel right now. My name is Amita. I am from Nourish Doc, a global platform for natural and holistic therapies. I'd like to introduce all of you to Gadi Marcus, who is joining us live. Welcome, Dr. Marcus. Well, welcome, Mr. Marcus, sorry.
Thank you, thank you. I'm not a doctor yet. Thank you.
I know, I'm sorry. Okay,
no,
well, yeah, go ahead, please.
I insist on this because it's important for our position where we are in the context of the medical community and society.
Yeah.
Well, maybe we come back to it later. So I'd like to thank you for this opportunity to talk about the immune system and to present or have this free talk. It's more of a free talk than a lecture. The first thing that comes to my mind is the fact that we are in 2020, and according to the Chinese, each year has a specific character. You probably know this from the Chinese astrology, the animals and so forth. But this year we are in it's called a metal rat year. So the color of the year is metal, is white, and the animal is the rat. And the rat is the first one, the leader. It's actually something which is representing a new start. But along with this new start, you have this whiteness or this metal, this yang of the metal, very, very harsh metal. And what metal means, it's a metaphor for something that is making a distinction between what is necessary and what is not necessary. So if we like it or not, things are going to end this year quite abruptly. And at the same time, this is what the Qi says of the year, and we have to check and see if it's true. And what it says that many things are going to end. You can say die also, or finish, really finish. But at the same time, it has this rat Qi, or this leadership quality, or this new start. So what has happened in the past few months, the Chinese New Year begins actually in usually around February. So it's quite close to when the pandemic started. And what has happened in these past few months is a lot of fear. This pandemic managed to create a lot of fear among people. That if you examine the mortality rate in Israel, it's about twice the amount of flu. And most of the people that are harmed by it are elderly, and not only elderly, but also ill. There are some young people, but most of them are elderly and not well. So it's created some kind of great fear for many people. And at the same time, it disrupted all of the normal life cycles. It also ended a lot of jobs and ended all normal daily cycles of for example, exercise and many people have been thrown off. The children don't go to school, so there's not order and no cycles in the houses. And so this is throwing people off. And what is it? It's a virus, and a virus is some piece of genetic information. It's not alive. It's not like a bacteria, and it wants only to replicate, and it can't replicate by itself. It needs some kind of host cell, and viruses are specific to usually to specific cells in the body. And another cause of fear for people is the fact that the virus is going to mutate, and they keep repeating this. And viruses mutate, and this is what they do. They change all the time. So, for example, in the first wave of the coronavirus in Israel, the mortality rate was higher. I don't know if it's because the virus changed or mutated, or because the healthcare got better. Maybe it's a combination of the two. In any case, our health depends on our ability to cope to invading pathogens, whether it be bacteria, virus, fungi, prion, or just chemicals, or things like this, or poisons. So the immune system needs to, in the first place, react to the pathogen quickly, and what kind of pathogen it is, and remember it for future use. So there are two types of immune system in Western medicine. One is called innate, one is that you're born with, and the other is acquired. It needs to be exposed to pathogens and to learn the pathogens and to adapt to pathogens. Yeah, this is a picture of a virus, of the genes, the genome, and how it uses the host cell to replicate itself. What they did in the medical, you could say, society or medical health ministry in Israel and everywhere else in the world, they isolated sick people from not sick people, and isolated people from each other. So this is probably the only tool that they have at the moment to contain the pandemic. And this is, as I stated before, causes a lot of problems, disrupting daily life, and businesses and livelihoods are damaged, and social life is damaged, and so on. Often these viruses, they come from animals, wild animals. In this case, I think, I don't know, the bat comes in close connection with domestic animals, and from there to humans. So it's also common that the viruses change and mutate from one species to another. The other way, maybe we go down one more. Yeah, so this is the shutdown, what they do, and there's isolation. And the other way to deal with the pandemic is to let everybody get infected. And that way, most people will have immunity. What they need to guard against are the really sick people and the immune deficient people, and this is what they did also in Sweden. So in a short period of time, many people died. So they didn't isolate people, but they let them become infected and they continue normal life and normal business life, and they didn't harm people on those levels. This is a controversy because people will die here also, but maybe they die in a short period of time, in a short span of time, and maybe the same number of people will die elsewhere where there is quarantine, but over a longer period of time, until either there's a vaccination or a herd immunity, what they call.
Yeah, so I think, I mean, you talked about the herd immunity earlier, like, so Sweden did that. And then if you don't do the herd immunity, like, like you said, in a short amount of time, in a short span of time, they don't control anything, and a lot of people would die. And now the other option, which a lot of other countries are doing, is the overload of the medical system, right? So that's what is happening across the world, for that matter.
Yeah, this is the main reason, you can say, for the quarantine. They are fearful that the medical systems are going to collapse because they will have so many patients at the same time, and the doctors, they're over, and the medical staff, they're overrun by work. And this is, so they call this flattening the curve. They need to flatten the curve. So you will have maybe the same amount of patients being ill with the pandemic, with the coronavirus, but over a longer period of time, so they can manage it and at the same time provide healthcare for other illnesses. You can say normal day-to-day illnesses.
Okay, so let's talk about what affects the health and the immunity. So
yeah, so in my mind, what this did is bring to the surface the differences between alternative medicine, and here we talk about Chinese medicine and specifically acupuncture, and you can say normal Western medicine. So it's a bit of a tight spot, because during the quarantine time in Israel, or some of the shutdowns in Israel, first they allowed alternative medicine to work, and then they said, no, you can't work. And then there was an outcry, and they said, okay, you can work. And then they said, you can't work. So finally, we cannot work. We're not allowed to see patients when there is a shutdown or when the society is not completely open. So in effect, legally, we cannot treat people with another form of medicine, which is a shame. So the only, you can say, treatment right now, which is allowed, is the social distancing and the hygiene, and washing your hands with soap. So what I would like to talk about, this was like an introduction, what I would like to talk about is not about a specific form of treatment for coronavirus, because I don't treat coronavirus patients. You're not allowed to come near them. And I would like for us to explore an opening, open up this idea of what is health and what is immunity. So before that, I would like to give an overview about the Western immunity, if it's okay.
So I think
it's the next.
Yeah, sure. No, I think what I would suggest is we take next 10-15 minutes to your talk, and then we want to open it up for questions. So let's just stay focused on the immune system and how other things can help. So
okay. So would you like to hear about the immune system?
Yes, yes.
Yeah.
Let's just stay focused on the topic, on what the immune system is, and then how can we strengthen ourselves. And I think let's just stay focused on that. So let's talk about immune system right now.
Okay, so the immune system, basically, like I said before, has two parts. One is the innate, or something that you're born with. This immune system is built mostly of, very briefly saying, it's built out of these white blood cells, which are coming to the pathogens and basically eating them. It's called phagocytosis. And the second part is the acquired, which means that you need to be exposed to pathogens, and then you can, and then the system can learn the pathogen in the process where they create a key and a lock, or antibody and antigen relationship. So the innate, the first one, is called the first line of defense. And like I said, it's composed of these white blood cells, but you can also expand it to the skin and the mucous membranes. So I think there's a slide of the skin. So these are the white blood cells, also of all the systems, and this is the skin. And if you look at the layers of the skin, you have two layers which are interesting for us. One is the epidermis, or around the dermis, and then there's the dermis. And the lower layer is just a fatty insulation layer. And the epidermis is really like a fence. It's like this metal I was talking about before. Its job is to seal the interior of the body from the exterior. And if at any point this layer is harmed or cut or dry or damaged, pathogens can enter and into the middle layer of the skin, which is the dermis. And the dermis has a lot of blood vessels. So there they can meet the white blood cells. And then the next slide, I think it shows the mucous membranes. So the mucous membranes, they are also meeting the external world, and they are in the eyes and in the linings of the lungs, of the bronchias, and also in all the digestive tract, and also the sex organs, and so on and so forth. So they are really a barrier, a physical barrier, but also they allow for white blood cells to enter. So this system is like an army, and it's fast moving, and it's quick, and it's aggressive. The second system is the acquired system, and this is the system that really has to deal with this virus, because it has to learn it's completely new pathogen, and it's also made out of white blood cells, lymphocytes, and it's slower to act, and it has to create a lock and a key to the specific pathogen, and it will also many times be for life. So only the first time you're exposed to a new pathogen, and the body also learns it. Now, generally speaking, about these two systems, the immune system can either be deficient, not enough, and then people get ill a lot, or it can be overactive. That means it can be, you can have allergic reactions or autoimmune reactions. These are the two extremes of the immune system. So in Chinese medicine, so now we talk about Chinese medicine, it's a different view. on the left, you see xie qi. Xie means perverse or harmful. Qi is this some kind of energy or life force. And on the other hand, we have the zheng qi, or the upright qi, or the healthy qi. So the xie qi is the pathogen. It's coming from the outside. And the zheng qi is the qi of the person. And this dual relationship, this strength, you can say the strength of the qi of the patient in relationship to a pathogen. And we don't have this in Western medicine. In Western medicine, we only have a certain aspect, which is usually the lab test, which show us the condition, for example, of the blood. So in Chinese medicine, we have this zheng qi, upright qi, and a lot of the ideas on immunity is how to strengthen this upright qi so it can meet all the pathogens in life. Okay, so far, any questions?
Yeah. No, I think let's just finish about the Chinese element system and how it relates, and then we can take the questions in the end. That's fine. So
okay. Health depends on many factors in Chinese medicine, of the body and also of the mind. And it's not only that you're not ill, it's an equilibrium which changes from period to period in life, from season to season, from age to age. And you take into consideration many factors, hereditary, also physical, also your social standing, also the emotions, also your lifestyle, and also your diet, and also the constitutional aspect. And these constitutional aspects, they're also related to the year of birth, or the time that you were born, not only to your parents, but also to the year of birth. So in order to have this, to put some order into this vast amount of information and how to deal with it, you have this system of 5 metaphors or 5 elements. In Chinese, it's called Wu Xing. Wu, 5 Xing transformations. So if you look at them, there's wood. Any movement starts with wood, and then there is fire, and then there is metal, and then there is water. And usually earth is in between, mediating all of these forces or metaphors. They also contains, if you look at this picture, they also contain organs, physical organs. For example, the wood contains the liver and the gallbladder, which is the liver. The gan is really important in relationship to the immune system. And if we have time, we can talk about it. And they have 2 basic relationships. If you look at the arrows on the outside, the red arrows, they're showing clockwise movement. And this is called a supporting or nourishing. In Chinese, it's called sheng, to give life. It's a life-giving cycle. And then there are these arrows in the middle, and they are showing a ke, or a rebalancing cycle. So if we talk about immunity, then we were talking about the sheng sorry, we're talking about the xie qi, the perverse qi, and the upright qi, the zeng qi. So the first reason for any invasion of perverse qi or pathogens is weakness. The weakness of what? Weakness of, we call it qi. Okay, so so for example, if we're talking about the liver as the center of the immune system, if the qi or the energy of the liver is weak, then we have invasions of pathogens. What are the invasions of pathogens? They have 5 qualities like before. For example, if we talk about the wood invasion, we talk about wind invasion, and this can be either physical wind or it can be emotions. Emotions also invading us from the outside. If we talk about fire weakness, the weakness of fire, this will in turn lead us to have depression, no joy in life, but it can also be a more physical type of invasion like radiation and so on. If we talk about earth, which is, I think there's a slide about the pathogens. This is qi. Yeah, here they put 6, but there are actually 5. Heat and fire, they're the same. Maybe we go back to the other slide, possible, or the other one back, yeah. If we talk about earth invasion and we talk about damp, what is damp? Usually it's dampness coming from food. You're susceptible to too much dampness from food, or it can be also fungi. Metal invasion, it can be dryness of weather, but it can also be some mild viruses. Water, what is water invasion? This is coldness invading the system. It can be real physical coldness, or it can be cold. So, in a nutshell, this is the theory of the Chinese immunity. I can go on and on, but I have a feeling that maybe people would like to ask some questions, and I'll try to answer.
So let's just finish this and then we'll open up for questions. I think that would be my suggestion. So you talked about the Chinese 5-element system, and you know how, and then the concept of qi, and then maybe the pathogenic influences.
So you would like to know probably what is in our daily life, what are these pathogens,
yes. So I think what people are welcome to put in their chat window, but I think what people want to understand is the what the role of Chinese medicine can play to help our immune system. That's really the underlying goal here. So so let's
the first thing to do is to understand a bit about the system. So if we talk about on the left, if we talk about wood, then we have, for example, a lot of stress. That's the next one. No, the blue one. Yeah, this one. Thank you. If you talk about emotional well-being, if, for example, and this is quite common, people are stressed and overrun by a lot of emotional occurrences in their life, then this will harm the immune system. So it is important to find an outlet for these emotions and get enough sleep so you can process these emotions. And if not possible, then take them out of your life. in the fire, in the social life. These shutdowns and this distancing between people is causing a lot of loneliness and a lot of depression. And so it's important to have a social life and to find new ways to maintain your joy. In terms of mental, it means also taking care of the physical life. And people are, if they lose something or something ends, or if there's a death or an ending or anything like this, then people are going to neglect themselves on even the hygiene of their life. And the battery is the water, and you need to recharge and to rest, and at the same time you need to have movement and strengthen the system. And in the middle, all of these have to do with cycles and routines and of course diet. So what can be done for, you can say, for the people look at this and say, what can I do to make my life better at this time? I don't know. You have to see where the problem is, where maybe some people are have the best time of their life in this corona crisis, and they're not stressed at all, and they have more time to be with the family. And some people are eating a lot and going to sleep at irregular hours. So you need to see which system is out of order, and then you need to rebalance it. And for me, the best tool, this is the acupuncture. And acupuncture, it's a tool. It can be used just to do cosmetic acupuncture, or it can be used to treat symptoms. But the source of acupuncture is to rebalance the qi of the patient according to their complaint, according to what they want. And then this rebalancing will affect the symptoms. So usually we have some kind of, we would like to solve the problem and be practical. I'm all for it, but you need to see what is underneath it. And I think that if you change your diet, or you take herbs, or you go to massage, it will, I don't think it will change the underlying relationship of the qi. Maybe some people will disagree, but this is my experience. And not only that, the acupuncture is able to treat the body as well as the mind or the emotions, and it's also able to rebalance on a constitutional level of the patient, and it's also able to tailor make a treatment for each individual person. So we don't use, okay, so they will say, give me 2 points, 3 points that will boost the immunity. No, every person, you have to approach them in a different way to boost the immunity, because each person has strengths and weaknesses. And so you have to use that like a roadmap. In terms of acupuncture, it is able to nourish the immune system, and it is able to turn off allergies and autoimmune disease. And this ancient form of acupuncture is called Wu Yun Liu Qi, or 5 phases, 5 transformations, and 6 qi, or the stems and branches. It's the common name. That's it.
Great. Well, we are open for questions. If anyone has any questions, you're welcome to ask, put it in the chat window and ask questions. One of the things that you're welcome to put it in the chat window and ask questions. So one of the things you talked about, the acupuncture is very widely practiced here in California. And I think, you know, I don't know where the audience is from, but at least where I am in California, there is an acupuncturist in every block. So what, yeah, so would you also, you didn't talk anything about the Chinese herbs. Is there any, so can you guide some of the viewers, maybe something that they can, some simple herbs, the Chinese formulas or anything that helps for immune system rather than going to an acupuncturist, which, you know, I think most of us in California do. Like I said, it depends where you are from, but are there any, can you talk a little bit about the herbs?
Yeah, well, I used to study also with a lady that she used a lot of herbs, and I used to do a lot of herbs. And out of all of this, and if we talk, of course, it's an art in itself, and you have to give a formula suited for the person and blah, blah, blah. But out of all what I saw, there was, I'm not sure I remember his name, this guy from actually California. Could it be Michael Tierra? I'm not sure. But he said that all the herbs that you need in your life to create a cure, you can grow them in your garden. So you can look up some local herbs that are grown locally, and you can also look at the tradition of what we call it, the grandmother's tradition of using herbs. For example, garlic, it's a wonderful herb that you can use it's antibacterial, antiviral, and antifungal, and many things. But of course, nobody in the medical profession would like to investigate these herbs, which are common in our kitchen, and there are many. Actually, all of the foods are herbs. So you can, if you're interested in that, you can look it online, what you're eating and what it does, and there are some researches, and it's proven that you can use them for. Okay, so blueberries, you can use them to build blood, and you can use them to treat cystitis or infection of the urinary tract. It's endless, actually. But once you're interested in this, you can look into it. You also have to be careful not to misuse them, because, for example, etheric oils is also a nice way to apply herbs or medicines through your skin or through your sense of smell. It goes directly into the bloodstream, but you have to know how to use it. I recently, some lady was putting eucalyptus oil directly on her skin, which is not allowed. Only lavender and tea tree and that's it. All the other oils need to be diluted in a certain amount, and so I don't have any one herb to give people to strengthen the immune system.
All right. And any questions and comments before we wrap up from anyone who's in Zoom right now? Okay. I don't see any questions or comments. So, okay, with that, I'd like to wrap up this session. Thank you so much, Mr. Marcus, for joining us. And I'd like to thank our viewers for being with us, for supporting us. And please give us feedback about our sessions, how we are doing. We do a lot of educational sessions throughout the week. And so give us the feedback. We would really love your feedback. With that, thank you so much, Mr. Marcus, for joining us.
Yeah. Thank you.
Thank you so much.
Thank you
Bye-bye.
very much.